So I will present 3 ideas of the case of Colombian case so that we can open to debate, because I believe that this is what interests us most. 3 important ideas. Colombia has made progress in a non-centralized policy, neither in services and specific needs, because we have high inequality levels of the 5.3 million children that we have in early childhood, 2.5 million under poverty conditions. Although we have this situation, we are analyzing it, and we try to do an exercise that guarantees rights more than working from risk or vulnerability focus. This is something different that we do in Colombia too. And so we have to understand that early childhood should generate. We should have strength to work with what happens before. We work before conception, and to set conditions to work with children above 5 and 6 years of age. And the third element would be intersectoriality. That is where many have already realized, I believe, that this is one of the main debates in institutional arrangements. But 3 main ideas regarding intersectoriality, to give you some theory. Number 1 would be to understand intersectoriality. There are many forms to see intersectoriality. One can be seen when you add different sectors: health, education, culture, you call child protection, social protection. This exercise can be one, it's absolutely valid. This would imply in management work only coordinate. So everybody should know each other and to see what each one of us do. A different case, when under an encompassing public policy, after we define what we want, we define the competencies to each sector based on the same structure. Therefore, we transit from coordination to articulation of sectors, and the articulation deserves other type of management that is totally different. Intersectoriality is not and cannot be what replaces or becomes an instance or a firm that goes against what is sectorial. Sectoriality is to guarantee 2 main working scenarios. One, to identify intersections where health and education meet, when culture meets, when social protection comes in. And the intersectorial management must be concentrated in this intersection, so we can create the strengthen the second element, that is institutionality, that is to strengthen sectorial plans, which is a very intersectoriality. It cannot annul the competency of the health sector or the competency of education sector. They have their own agenda, but they have a common point. For the case in Colombia, the common point, through something that we call a whole attention route, this basically has been the meeting point, and we define this with the pregnant woman, the family, the boy or the girl. This is where everybody meets when it comes to management. But the next step is to strengthen the institutions. And the last element is, following this institutional architecture, Colombia decided to see how in a short period of time we could make progress in a much more agile way in our policy deployment. In terms of governance, we create an institutionality that we give to our presidency, and they have 2 important roles. One, to chair an intersectorial committee and to coordinate what is intersectorial, and they delegate competencies to all the sectors and here we have around 7 sectors participating, and we work for early childhood. So we have much more themes. I would just like to give you general guidelines here. But I believe that we will work with the same theme so I don't escape from this panel's focus. Now I would like to give the floor to our participants. So you may pose questions to the different panelists, especially our three speakers, the ones that will give us the answers. Thank you very much. Una pregunta para Cristina sobre el seguimiento. El seguimiento. Las familias con quisiera que tuvieras más tiempo para explicarnos cómo se da el seguimiento de las familias en su proyecto. Just that I had very little time. Well, follow-up, family follow-up for us. The families have two main entry points. One would be our certification, and each child has one identification, and we cross this information, and based on other information systems that we have in different institutions, especially in the Ministry of Social Development, these are families that are eligible for fund transference, and we cross this with other risk factors from social and sanitary point of view. These are families that are referred by health systems, by organizations of civil society, and then families. We have, from the beginning of our program, an assessment and monitoring process that is part from the initial outline of this program. Today we receive an external assessment, and this impacts the family assessment in the households, but we have an assessment and monitoring that is very strong in our program, and we have two intervention modalities. In the beginning we had 4, and as we started working today we have 2 modalities. One would be the good beginning, that is work with pregnant women when we realize that there is a woman that is pregnant from the beginning of her pregnancy, and then we start visiting, and we do this with each family. We have targets that are clear throughout a period of time with our pregnant women. We start with the first stage of the pregnant until the baby is 8 months old, and with the rest of the family we work an average of 12 months. Today, due to a matter of resources and how the program was outlined, we are using international experience in terms of family follow-up. For example, we see families that no longer work with the program. We want to give continuity to it. So we have to see they have to be connected to one sector, and today we see how these families give continuity and how they are protected and if they are inserted. And with each one of these families, what we do here is we have a modality and we have targets in order to drop malnutrition. There's an insertion of family to the rest of social benefits, and of course we follow up and we continuously work with them in their households. And within this component, we can say that we have 9,000 families with 40,000 people, and the indicators with which we work with is of good improvement from the sanitary and the social point of view. So thank you very much. We have another question here.
For the 3 countries, about whether there's efforts to integrate or to have social policies that integrate the different sectors, have looked specifically at the role of fathers and the extended family in the context. And talk about gender from the women angle and social protection of women and children. But unless the fathers are included, and sometimes, of course, the extended family as well, we see very little behavior change in the household. I was just curious about that from the 3 countries. Thank you.
Posso começar? Esse é tema bem interessante, porque o início do programa.
Very interesting topic. The Mother-All program, one of the things that would happen very often is to see that women found it hard to participate in the program, because actually the program is in the area of greatest vulnerability, people with very little access to education and all. So there was a gender barrier. There was the thing, why should women learn how to read at 17, at 18? So we faced a lot of resistance. And then the fathers started to come, and they started to participate, especially in terms of education, in the circles for education and culture. So they started to go, started to attend, and we said, well, the program focuses on women, but we said, no, of course we are going to focus on the women, but we're going to reach the whole family. And the fathers were the first to come. And today, what we see, if you go to Pernambuco, if you visit the program, you're going to see that there are many fathers attending the program. Also, some fathers taking the baby to healthcare services and to follow up on the children. So this involvement of fathers was something that happened naturally because the space was created for families. It was a space to welcome the families. So women go there to get what is their right. I mean, it's nothing that is given to them as charity. No, it's their right, because they know that there are some policies going on, and this ends up reaching the whole family. In the Mãe Coruja program, we have lots of videos showing the opinions of the families, mothers, fathers, and families as a whole, and they talk about how much it changed their lives. If we only had time to see, but someone said, well, how could I care for people if I was never cared for? I was always being mistreated by the family, and she had given away her children. Today, the family is totally structured. So we follow up on the families. We see the change. Leonardo also challenged us to work on the topic of violence. And I said, well, this is coming naturally because we opened up a network for care in this space, and we are showing that there are policies for this. So some sectors came to us, some sectors of the formal policy, because we reached certain areas that had no, the public policies would not reach. And that's why we were created. The great challenge that we have today for the next administration is to show that primary care is very difficult in such a huge country, a continental country. So it's difficult for one program to solve all the problems. What we need to do is locally to create other models of management. We need to care for the challenges at the local level. So, for example, I am a physician. I'm a family doctor. And I say that the confidence and the respectability of our figures is much greater because we're there. We're close to regional and regional communities, and we are able to intervene. This is just a part of what happens there. I would like for you all to...
Okay, could our panelists be shorter in their answers so everybody is able to answer? And then we will continue with Cristina. But obviously, please, everybody be very brief when you give your answers because we have many people trying to ask questions. In
The parenting strategy is the development of parents' places. Parents' places, and this strategy arose out of consultation at the community level. We have 3 levels of parents' places. Level 1 is where parents, is a place where parents come to just get information, written information. Level 2 is where they go to actually get parent support, where there's a trained parent facilitator. Level 3 is where there are actually referrals, specialist services available. We expect level 2 Level 2 is what we expect to be all across the country. Level 1 would occur in more deeply rural areas, and Level 3 would occur in association with hospitals or major centers. The parenting strategy, the parenting policy has in it first the importance of fathers, so that sets the stage for the country. And within the strategy and within the parenting standards, we address gender, and we ensure that all our parenting programs that are delivered through the parents' places, that fathers are a specific group that are addressed, because, of course, a lot of children in Jamaica grow up with fathers at a distance rather than fathers living in the home with them, and we all recognize the importance of maintaining fathers in advancing children's development.
Gracias, Mauro.
We are very concerned on the father's role in all the components of the program. In the universal meetings, we have made some works with some famous soccer players, as Luis Suarez, who maybe was really, he was not maybe the most loved child, as we saw him biting someone else in the World Cup, but you know, we are using these soccer players in order to show how important is the role of a father in the breastfeeding, all the images of communication. We need to have a man in the family structure. That's something we are doing, something that is concerning us. And in the structure we have created in the house, the importance of uncles, grandparents, grandfathers, fathers, most of our projects are, or most of the houses we work with, they are being led by women. And I think time and non-paid time is something that is very concerning in our country. Low wages for women in my country, they are definitely a problem. We do not have access as women to top quality jobs. So I think the country must undergo for some cultural changes, and that's why we are bringing the men's figure to these practices and these policies, and maybe avoid the relation, avoid talking only about the relation mother-children, and involve the father as well.
Bueno, esta pregunta es sobre todo para
This question is for Elizabeth. We saw you have like a group or a team which was specialized on working in the field maybe and take your projects to the field. And I think that's a huge challenge in Colombia. So I want to know from you and maybe to the other panel members, would you give us a couple of hints of elements that maybe are important to keep good quality in all the teams working in the field maybe?
Actually, our network has 840 people directly employed. We have doctors, nurses, psychologists, social assistants who are in the management and monitoring area. Ever since the beginning of the program, we've been very careful with education. During the first year, we aligned the knowledges. Now, when you talk about education, of course, you have specific professionals, specific from the education area, with a certain level of education. The education cycles are in modules. So we have topics: women, children, family. Learning continues. We have continuous education for all professionals. We talk a lot about multi-sectorial building or constructions, but we don't have this from the universities. So it is a permanent effort of ours. Every week we have a meeting, ever since 2007. Every month we have a meeting at the central level with all local coordinators, and every month in each region of our state, we work with a different topic, educating people. Right now, we are discussing the formation of Brazilian people. We don't want to be very authoritative when we intervene in the different regions of Brazil. So we have to have some more knowledge around that. Currently, the program is totally funded by the state.
Thank you very much. Our program is funded by the national government. 100% of the funding is coming from the government. We have 250 technicians working in these two areas. In the main area, in the central area, we have many technicians, highly specialized, and they are all under the coordination of the agency. So they are highly trained and specialized. When we work in health, for example, our technicians, they are as trained as any other technician in the health provider, in a health provider organization. And I think on a local level, we have some technicians ranging from 25 to 35 years old. They are very young, from social and health areas, and that's one of our greatest assets, because we have many technical capacities from these technicians working in the project, and we have a strategy which is very interesting when it comes to training sessions once per month. In the last 2 years, we've been training them with all the different subjects they need in order to face the problems the family may come with. So we have some partnerships with psychology universities. When we work with highly vulnerable populations, we need to, armor them, if I can say that. They must be protected against feel touched, too much touched by the hard living conditions of these families. So 100% of our resources are devoted to training and human resources training. Lo que hemos hecho hasta ahora es intentar mantener todos los programas que tenemos para los padres.
There are quite a few.
Hay
And
muchos
so
programas que
we
tenemos
have
en
one that's
Jamaica.
done through the vocational training program, the NCT VET vocational training, where you can actually be certified as a parent facilitator. Anglican Church runs a completely separate parenting program where they have trained facilitators for many years all across the country. And then there are individual groups that have developed parenting programs. Parenting Partners, a regional Caribbean organization, has developed a parent program for certification. We have pulled all these persons together. We know exactly where all the parent facilitators are, and we've also ensured that our staff from the Early Childhood Commission are actually trained as parent facilitators. We have an early childhood resource center in every single parish in Jamaica. There are 14 parishes. And the Early Childhood Commission officer at these resource centers are going to be developing all of them as level 2 to level 3 parents' places, and they will become the hubs for parenting for the entire parish and will supervise the parenting programs that take place in each parish. So what we've done is just pull together all existing, because that's part of our role, is to coordinate what is out there. So pull together all the existing parenting facilitators, ensure that we know where they are, and that we can direct persons to where programs are. We've also mapped all the parenting programs for early childhood across the country so that we know exactly where they are. You see, the parent training, parent facilitation requires specialized skills in terms of adult learning, and it's important that facilitators are quite highly trained, or else you can actually cause some unexpected interventions by not having persons who are adequately trained. So our job was to identify the programs that could continue to deliver, continue to support parent facilitation, and then have access to these highly trained persons across the country.
Bueno, gracias. Vamos a hacer ahí tiempo para dos preguntas.
I think we have time for 2 questions. But this time, the questions should be addressed to only one panel member. Please, you.
now you guys solved the issue of mortality. So what are you planning to do next? And in terms of early child development programs, I wonder if you guys are planning to use some of the ideas developed in Rio Grande do Sul as the PIN, or you guys believe that you should do something different using same principles but aligned with cultural aspects that are more peculiar in Pernambuco. And also I was going to ask to Cristina and Maureen if you, even in a smaller country, you guys have to deal with issues of culture aspects when developing a program for the whole country.
Please, short answers.
As I said in the presentation, we were able to reduce infant mortality. It is still on our radar. The mortality rate is 13 per 1,000, and we are now working with child development, with toys and in a playful manner. This year, we trained staff, we imparted knowledge. Last year we talked about neuroscience, and now we are talking about playing and toys. The idea being that a family should identify children's dysfunctions in with toys and in playful situations. So we want to approach families, allowing them to identify problems. Toys with sounds and so on. So we want to strengthen families so that they can play with their children and develop a deeper bond with their children. We have toys, we have kits, we have indicators that we are developing. We chose some topics coming from neuroscience to culture, and we are refining the design. This program is different from PIM. As Liège said, this program in the south of Brazil had to address the specific challenges of Rio Grande do Sul. We are focusing on health, education, and social development, and we are working with the people so that they can be part of this network that will allow us to identify problems in children. We have to look at families and be able to identify that there is a dysfunction in that family, in those children. So this is what we have been working on. We are working on the indicator.
Thank you very much. We have 2 additional questions, and on a single answer, please. Andrea? Yep. My question is for you, actually, Constanza. How are you monitoring the national road for the implementation of your projects, and what about the cultural differences you have in Colombia? How do you adapt your program to your native peoples? Maureen, please, would you answer that question on how to take something as punctual as that project to the country level?
Yeah, across Jamaica, we don't have that much variation in culture. But what we do ensure is that any program that we implement, we ensure that we have a very, very strong monitoring and evaluation framework so that we get feedback that allows us to adjust the program to meet the needs of the specific community afterwards. So everything is built into a monitoring and evaluation framework. But there's actually not that much culture difference across Jamaica.
Yeah, I think in Uruguay is not as different as Jamaica. I think, of course, we have different problems depending on the region. We have maybe slight differences. Uruguay has a historical depth with children and young people. That's our main challenge, I guess. As a program, what we've done so far is try to understand this diversity. Each country is diverse, I guess, and I think when we come to these meetings, you study a lot, right? And I've studied a lot recently, and it's fantastic to meet you all and understand that we have some concepts here that should be translated into Latin American realities. Each country has its own story and its own background, and maybe the history from Jamaica is very different from the history from Uruguay, and maybe the recipe they use in Jamaica can't be used maybe for early childhood development in Uruguay. So our challenge as a region, I think, is to understand this topic and make that this topic be part of the agenda of policymakers. I think that's the main challenge here. Try to communicate to main decision takers and policymakers, to payers and all those people behind the policies, to listen to our ideas and set this as a priority. Each country must follow their own way and try to reach the best path to reach the new reality. What we need in Latin America is understanding this. The importance of this topic is not a topic anymore. It should be a state-level policy that must continue regardless the government in the office. I think we are progressing when it comes to social indicators, but the real economic sustainability of Latin America will come in the future generation, and we are not doing well so fine. So no formulas. I think each country must find their own way and try to understand their culture, measuring and monitoring everything, but according to a public policy. Sometimes we discuss a lot on small things, and we are not defining the policies in a better way. Thank you very much. Okay, to wrap up about the questions on Colombia, how can we monitor the national road? Well, in Colombia, the Ministry of Education was responsible for identifying the main spots. We have 8 different projects, 3 related to health, 3 to family welfare or well-being. We have civil registration, and we have education as well. These 8 projects are converging in one single office, and we have some assessments that can be run and can be followed up online. What we do is try to check if the problems have been identified and see how the tasks have been completed. It's been 6 months working with 1 million children, but honestly, I think we have only 30,000 children registered in the system. So that's one of our main challenges for the future. For Colombia, when it comes to cultural differences, yeah, that's definitely a bottleneck. We have more than 100 indigenous communities living in the country, native peoples, and we are working with them, trying to take these projects to them. We are working with former slave communities and racial communities, and we are advancing with more than 20 different peoples in the country, trying to understand their costumes, their habits, their culture, and I think that's something very, very important. The health system and the education system in Colombia have played a very important role, so the PMOs and some other health providers, they'll work with these communities as well, and they will serve these communities with health services. Well, I think that's all for this panel. I think Eduardo will give us some announcements. Thank you very much. I'm sorry for being so rude, but time was ticking. Thank you.